These are some of the questions that we've heard we've done a couple other meetings as well as some conversations. And so we want to answer these. Maybe you have these same questions and we'll get them answered now. And then we will open up the floor to other questions that are not answered yet. Where will the clinic be? The clinic will be right where it is now. It's not moving. It's going to stay at the current location. They're on Elm Street, right across from the hospital. The clinic, will the clinic's name change? The clinic's name will change. It will be Flint Hills Community Health Center. Same, where will you get providers? Are you bringing in new providers? We have 3 providers, Dr. Basham, Carrie, and Carla, 2 nurse practitioners, and then we are recruiting a 4th provider. Will the pharmacy still be located at the clinic? Yes, it will be. We are working, which I did not mention this earlier, but we will be working with the Eureka pharmacy. It will stay where it's at, and we will be contracting with them to do a 340B program. 340B is a discounted prescription program, and sliding fee or full pay patients, or those with insurance, about a 50% cost savings in the cost of the drug. And so we will be implementing that. That will probably at the earliest start April 1st. So it won't be March 1st, but it is coming and we are in the process of getting that working there. Another question, will the clinic still be connected to the hospital? We will still be partnering with the hospital. It will not be the employees will become employees of Flint Hills Community Health Center, not Greenwood County Hospital, but they're still going to have privileges at the hospital and do rounding and admitting there as well. Which goes to the next question, who will see me if I'm admitted to the hospital? It'll be the same as what's happening now at this time with Dr. Basham, Carrie, and Carla doing the rounding and seeing. The weekend, the emergency room providers will be covering the hospital over the weekend hours. How does this affect the emergency room? This does not affect the emergency room. The emergency room will still be operated by Greenwood County Hospital with the providers that they have. What about Dr. Hutchinson? Dr. Hutchinson has chose to stay with the hospital, and so he will be working there 2 days a week, going over to the hospital building for those 2 days. And they've started a rural health clinic, moved it there, and they will also have a mid-level the other 3 days a week. And another question, can I keep seeing the same provider? And the answer to that is yes. Dr. Basham has been your provider. He will continue to be your provider moving forward as well. How will labs and x-rays work? The hospital and us have agreed to continue the labs in through the hospital, and they have kept the lab technician that's in the clinic. She will stay there, continue to draw the labs there, and then the hospital will process them. And then they will charge us, and we will then bill the patient, and that lab service will be on the sliding fee scale as well. Same way with the x-rays. The x-rays the hospital will continue to do, and so it'll be a referral to the hospital to do the x-ray, and then the results will be sent back to Dr. Basham or one of the other providers to review. With new services, will there be enough room at the clinic? This question was referring to, we have medical services there now, we're looking at dental and behavioral health. The answer to that is we're still looking at where everything's going to be for dental and behavioral health and how that will work. There are opportunities there, and so we've got to find where to put them at. Will it be at the same clinic? That's still being looked into and seen there. Next question, will the clinic be for walk-ins only with no more appointments? The answer is no. We would prefer to have appointments scheduled. That way we can have Dr. Basham know who's coming in at what time. We will have blocks of same-day appointments that are available. And then if a patient does walk in, then we will have to look at the schedule to see how full Dr. Bastion is, or Carrie or Carla, and then hopefully we will be able to work them in as well. But the main thing there is to go ahead and call and make an appointment. That way you know what time the appointment is, and our providers know when to see you as well. Next question, will I be able to get an appointment if so many new patients will be going to the clinic? Good question. We want to keep the patients that are currently used to seeing their provider. And so as we continue to monitor that, if it's taken 2-3 weeks to get into Dr. Bastion, then that tells me as the CEO that we do not have enough providers here. And then we will look at what we need to do to increase that. That way the new patients that are coming in can still be seen, as well as the established patients to continue receiving their care as well. Betty, I'll let you answer this next question here, and that is, how does the sliding fee scale work, and can you give an example?
Well, like Philip said, the sliding fee scale is based on your household income and the household size. So we have specific requirements for documents that we need. For example, just some of the items are the most current paycheck stubs, the last two. There's a Social Security income, any disability income, unemployment, anything like that. And again, I stress it's the household income, so whoever's in the household and the size. Also, I always have to say that this isn't our requirement, it's the requirement of the federal grant, so that we can have the sliding fee scale and give it to all the patients that qualify. And we do get audited on that, so it's very important for us to collect that information. So just an example is, let's say a mom and 2 children, and she's working one job, and it's hard to make ends meet on that, and so she would come in, she would bring her income, like from her job, the 2 current paychecks, and then she'd have a household income of 3, her and her 2 children. We calculate that and put it into our practice management system, our electronic health record. It calculates the poverty level. We get that information from its federal guidelines, so it's based on federal information. And then once that's calculated, then that slide applies to all of the services that that patient receives. You have that for medical here in Eureka right now, but if you were to come up to Emporia and seek some dental services, behavioral health services, it would apply there as well.
So if they have specific questions on that, the best is to call and ask.
Yes,
right?
We'll be training all of the access specialists, the front desk people, on Monday, Tuesday, Wednesday, and all those specifics. And so there's a lot of gray areas on that we found, and so it takes them a little while to get that real good experience and to answer all those questions. But we'll be training them on that, and then also we'll be training them if they have more questions or if the patients have questions, they can call our business office in Emporia to get some more specific details if they need them.
Next question, will the clinic only be for low-income people? And the answer to that is no. We will take any insurance. We will continue to provide the services to the patients that are currently coming, and then we will look at other ways to continue to serve the community. What kind of medical and dental insurance will be accepted? We want to be able to take any and all insurance that's out there. That way, that is not a barrier to see a healthcare provider. And so if it's an insurance that you have that we don't take at the current time, still call us and ask us about it, because we will look into it to become a provider for that insurance company as well. And then you can always connect with us on Facebook. And so we are on Facebook. I think you can search for Flint Hills Community Health Center, and you'll be able to find our page. So like us to stay caught up with what's happening, as well as future promotions too.